Do you have neck pain, arm weakness, or even numbness and tingling going into your hands? If you checked any of these boxes, keep watching the video because I'm going to show you what to do about it. Hi guys, I'm Mickey with Therapy Dudes, and today I'm going to talk about different types of neck pain and neck injuries. First, we need to break down the different types of neck injuries that there are. One of the first ones that we're going to talk about is degenerative joint disease, or stenosis. Now, pretty much everybody is going to get this one later in life. It usually happens in older adults, and it's just because everything starts to compress and decay, just because our bodies are breaking down. And what happens is, when that joint space compresses, it's going to entrap the nerve and limit the nerve's ability to be able to flow back and forth like it normally should. Now, with DJD and stenosis, what can happen is you can get radicular symptoms that flow down into your arm. So all of the nerves that control your arms come from your neck, and they end up going through your armpit here and down through the rest of the arm. Now, depending on what type of symptoms you're having, whether it's pain, numbness, tingling, and where it's at in the hand, will tell you which nerve is getting entrapped on which side. One of the other causes for neck pain would be a spinal fracture or a crush injury. Now, you can get these from headbanging too much at a concert, whiplash in a car wreck, or any type of compression fracture from a crush injury such as getting hit on top of the head. Now, these type of injuries are very serious and might require surgical intervention. So now that I've kind of broken down the categories, let's get into how you would treat those things. With any of these scenarios, it's always good to start off with conservative treatment. This includes things like physical therapy. It would be good to start off with a little bit of PT to kind of figure out what's going on with your neck, such as muscle tightness, hypomobility of the joints. Are there any muscles that are tense in and around the neck that we need to loosen? Are there muscles that are weak in the shoulders that we need to work on? And one of the other types of treatment is just pain medication. Yes, it's going to be good if you have decreased pain, but it's just masking your symptoms. You're not doing anything to fix the problem. If you do have to have surgery because your stenosis is too far gone or you have a fracture, here are a few different options of surgical intervention. So a corpectomy is just a removal of a vertebrae, which would help release some of the nerve tension. And one of the other type of surgeries is a cervical fusion. Now, with the cervical fusion, they'll take a few different vertebrae that need to be fused together, and they'll put some plates and screws to help keep that stabilized. So what are a few things to know if you happen to have the surgery? First, let's talk about precautions. Number one, we don't want an excess of range of motion in the cervical spine. We don't want a lot of flexion, a lot of extension, or rotation. No overhead lifting. The last precaution I want to go over is just no strenuous activity. You are more likely to put a strain and risk injuring that new fusion. One of the other things after surgery is you may or may not have to wear a hard collar. Now, this is a Miami J collar, and the one that I have here is just a regular size. Now, these should be fit to you and they should be adjusted for you. So one of the things that you want to notice is they come in two pieces. They usually use Velcro and they're adjustable. This one has an adjustment here. Some of the other ones have a little turn knob on the front for you to adjust, which raises and lowers the chin position here. As you can see, this piece here, it looks like kind of a tongue or a V. That's where your chin will fit. And you're always going to have an opening here in the middle there. All right. On the back side, this one has like an M, or it'll have two big circles, and that is to go on the back of your head here at these two little bony prominences. So when you're fitting one of these, you want this to be secure around your neck. You want your chin to comfortably fit on the chin pad right here. You don't want it to be suctioned back to you where your chin is coming off of it. You also don't want your chin to be back here, because you're more than likely to aspirate if you vomit, which tends to happen after surgery. So put that in. It's kind of tight. It's not too tight. And then we wrap this piece around, have someone help you if you need. Make sure that it's fitting snug, and then just kind of latch it there. Now, this is going to prevent you from being able to flex your head down, extend your head back, or turn side to side. Also, another tip that I like to give my patients: whatever hand you're dominant with, use that one to pull off the side. So leave one side attached, pull the other off, open it up, and you can take it off. Now, in conclusion, we've gone over different types of neck pain, what could be causing it, and what are some of the treatments that will be used to fix it. So if you have any of these symptoms, I urge you to go to a physical therapist and have an evaluation done. They can tell you whether or not your symptoms can be managed through PT and try to treat it conservatively with exercises and range of motion. Now, if things don't get better or you have imaging and you do have a fracture that requires surgery, then I would urge you to go to an orthopedic surgeon or a neurosurgeon to have that evaluated and get you scheduled for surgery. Okay, guys, that's going to be it for this one. If you like the content, like, share, and subscribe to the channel. Be sure to check back for more videos like this one, and I hope your neck pain gets better.